take Tylenol. Don't take it if you just can't. I mean, it's fight like hell not to take it. There may be a point where you have to, and that you have to work out with yourself. So don't take Tylenol. Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life going into the delicate little body of a baby.
Earlier this week, President Trump and Health and Human Services Secretary Robert F. Kennedy Jr. held a press conference where they, without much evidence, linked the usage of Tylenol during pregnancy to autism and went on an anti-vaccination rant, and it sent shockwaves through the medical community. But before we unpack all of that, if you like this kind of content, please hit the subscribe button. It supports the channel. Joining me today to break all of this down is Dr. Phil Huang with the Dallas County Health and Human Services Department. Welcome.
Hi.
As I was saying, earlier this week, President Trump and Secretary Kennedy claimed without much evidence that the usage of acetaminophen or Tylenol during pregnancy can cause autism, and they also kind of railed against childhood vaccines. What have the decades-long studies shown in terms of the usage of Tylenol during pregnancy for things like high fevers or pain?
Well, it's been in use for decades here, and it has about millions. And, the scientific evidence has not shown that Tylenol leads to autism. I mean, there have been numerous studies. It's certainly not conclusive to say that, you need to stop using Tylenol in that during pregnancy. And, again, I think all of the major health organizations have spoken out against the way this was presented, certainly. And it's very confusing for parents. And you think about it also that the guilt or something that this puts on parents, who might have a child with autism to then, just needlessly being putting that sort of stress and strain on them regarding their own child. And again, the science does not warrant that statement.
And as you said, Tylenol has long been considered safe to use during pregnancy. And RFK Jr. claimed that there have been studies showing the latter. What is he citing? What type of, and even during his, when in committee hearings, he will put forth these statements saying that he has studies saying the opposite, but it doesn't seem to bear out.
Well, that's why really it takes a lot of work, a lot of expertise to understand, and this is how science works when you do some of these studies. But you think about it, that you can't just look at some association and then say causality, that this causes something. I did a lot of work with, say, smoking in the past, and you do a study of smokers, and you might find some association with something, but then smokers are also more likely to say carry lighters, and then you can't then say, well, carrying a lighter causes lung cancer if you see that people who have lung cancer are more likely to carry lighters. And similarly, there's a lot of different factors, and the Tylenol is given for kids who have fever, to mothers who have fever or pain, and that fever itself or might lead to other, adverse health conditions. And so that's why not treating that fever with Tylenol, has a lot of repercussions. And again, there's a lot of confounding factors. There have been some studies then that look at siblings and, to try to adjust for some of those factors. So it's just, it's a complex way to interpret studies and science. And that's why, again, I think the scientific consensus is there is no justification for making that statement like that. Again, to say causality is not at all proven.
And it seems, and it's interesting that you mentioned that, because it seems like that when I'm listening to what he is saying, that he talks more about correlation than causality, and then puts it forth as if it's causality instead of just maybe a correlation.
Right, exactly. And it seems like, and this is where it's very concerning how politicized things have been. And, with his prior work, he's looking for reasons to, make an association between vaccines and autism or other things. And so, it's been studied for years, yet within the last year, he claims he would have the answer by September or something. I mean, that's just not the way things work, and it is not science-based, I think, with what he's putting out there.
When I was watching that press conference, and it brought me back to the pandemic years and some of the statements that Trump was making during that time, and there were people that actually they followed through with that advice, and it had some adverse effects. So I wanted to ask you, when there could be people out there, pregnant women who are listening to this, and they may take that advice. What could happen if they're dealing with, pain or high fevers that they're not treating, and they're not taking something that the doctors say is safe?
Yeah, again, I mean, not treating that high fever can have adverse effects on the child, itself. And, you need to take advantage of these medications. I mean, Tylenol, again, has been recognized as, safe during pregnancy, one of the few medications that are. And, to put this out there and to, as you say, have many women questioning, or physicians or others questioning whether they should be using that in that situation, it has a lot of adverse effects that can result from that. So it's not just a sort of innocuous statement. It has real implications and impact on multiple health outcomes.
And one other point that you mentioned earlier, you were talking about how this also could put some unneeded stress and pressure on parents who have children with autism. And there's a lot. How far has the medical community come in terms of what is known and what is unknown about it?
Well,
Where are we at in
again,
that?
this has been looked at for quite some time. There are autism experts that have been, this is their expertise that they've dedicated their career to, that have been looking at all the data. And, the consensus is there is not, there is no causality that can be concluded regarding Tylenol and autism.
Trump also talked about babies getting 80 vaccines before they're 18 years old, and then saying that some of the ingredients in those vaccines may not be safe. Can you talk about the truth behind that? How many vaccines do kids typically get before the age of 18? And can you talk about how safe those vaccines actually are?
Yeah, I mean, again, childhood vaccines and what we're talking about are incredibly effective and safe. I mean, you think of the millions of vaccines that have been administered. We look at the impact it's had on, say, something like polio. I mean, people forget what things were like before these vaccines and the amazing results we've seen of it. I mean, I was just talking to a church group with a bunch of retired people in their 80s, some of them in their 80s, that were talking about, I asked them, you were around before vaccines were around. Can you tell me about, what were your experiences? The one woman said, yeah, my brother got polio. I mean, before the vaccines, it was like, I think, almost 14,000 paralytic polio cases in the United States each year. For measles, we had 3 to 4 million estimated cases. 48,000 hospitalizations, 450 to 500 deaths each year. And we don't, when was the last time you saw a kid in an iron lung? I mean, that's what some of these people I was talking to, I remember seeing the kids and friends that had to be put in an iron lung. And we don't see that because the vaccines are so safe and so effective. And these arguments that, it's overwhelming the body, these number of vaccines, there's no evidence at all to justify those statements. I mean, kids are exposed to so many antigens and everything, and these vaccines are nothing. And the body and the kids can totally, it's very acceptable for the body to take these.
And to your point, and it's interesting that you mentioned that, because I'd also wondered about that. I wondered what people who, some of our seniors who remember what it was like before widespread vaccinations, how they would feel and what they're thinking about when they're hearing the president and the Health and Human Services secretary go on a rant to get vaccinations. And, you know, you and I talked earlier this year about the measles outbreak that we're seeing, unfortunately, here in Texas as well. And that had been something that had been basically eradicated, but we're seeing that crop up again.
Right, exactly. I mean, this is where all of these sort of misinformation, they create more uncertainty in the public, which undermines all our efforts to get people vaccinated with these, safe and effective vaccines, and that, hurts all of us. Like what we saw with measles, when you have a large number of people, population group that's not fully vaccinated, then you lose that herd immunity protection, and you see, the types of outbreaks that we saw in West Texas. So all of this, these questioning, the statements that put confusion out there undermine people's efforts to get vaccinated or to do things that are actually protecting everyone's health.
Another point that was made that I know that the Tylenol aspect of that press conference got most of the attention, but he'd also claimed that there was no reason to vaccinate newborns against hepatitis B. And when I was reading about that, I thought that's something that needed to be discussed because of what could happen if a child whose parent is infected is not vaccinated immediately. Can you talk about what could happen if that is not done?
Sure. I mean, it's when they instituted the vaccination at birth, that policy, I mean, we've seen dramatic declines then in those childhood cases of Hep B, because, sometimes the mothers can be asymptomatic, the tests can be incorrect. And it's tragic then because it can pass from the mother to the child during childbirth. And then if that child gets this chronic hepatitis, that can lead to, cirrhosis of the liver, cancer, long-term effects. And we've seen already in the data how the policy of the newborn hepatitis B vaccination, how it is like dropped the cases like by 99% or something. I mean, it has had an amazing effect. And to undermine that, is really just horrific to think about. And I'm so glad that the ACIP did not recommend on changing that, but I know that was on their agenda and they had those discussions. But that's, even like when they're talking about changing the vaccine schedule or delaying some. I mean, this has been, so the kids are there's going to be more susceptibility during different times because of changing that schedule. And when they make the recommendations for that schedule, it's based on a lot of different factors, like for how long there might be some maternal protection from maternal antibodies, when the child most gets that best immune response. All of these things have gone into those recommendations on when is the optimal time to give those childhood vaccines. And again, if you start delaying them, it causes confusion. It's hard to manage, keep up with that. And then you've got these periods when the kids are now more vulnerable and susceptible to these vaccine preventable illnesses.
The administration seems to have, and RFK Jr. especially seems to have zeroed in on autism, and they say they're going to go full speed ahead on a drug. I think it's
Glucophore.
Yes, yeah. Thank you for saying that. And to treat autism, what is why that drug? Is that a breakthrough drug that is having a lot of effect in terms of treating certain aspects of autism?
I mean, there have been, some small scale studies showing some language improvement, I think, for some kids who are administered it, but that's still not evidence to recommend, this widespread recommendation for that. Now, I don't know. I've heard something about that there may be some financial, link between some of the people involved. Perhaps Dr. Oz has some financial interest in that product or thing. So, I mean, again, it shouldn't be politics. It shouldn't be, these recommendations and things need to be based on science. And unfortunately, there's a lot of question about that, which undermines everyone's trust in any of these recommendations.
And what is the talk among the medical community. On that note of what you were just talking about, what is the talk amongst you all about the way this administration is handling the health of the country and the advice that's coming out of it? Because they seem to reject a lot of science.
Yeah. I mean, despite saying that he wouldn't make changes like to the advisory committee on immunization practices, I mean, I think all of the members were fired and then replaced with people who have a particular agenda that's consistent with what I think RFK Jr.'s work has been dedicated to for years on being anti-vaccine. And that's not, we want the decisions and the scientific recommendations to be based on science and not politics and political placements of these people. And so it undermines any trust that anyone has or should have in those recommendations. And so there are efforts, by some states, I think in the West Coast and the Northeast, to really look at some more evidence-based recommendations that are free of that political influence.
And when that happens, when that trust among the publics begin to break down, how difficult is that to bring everyone back to a common consensus so that everyone is safe? Because we all live in this society together, and we have to be on the same page when it comes to a lot of these diseases, so that a lot of people don't get sick and, or worse, die from them.
Yeah, I mean, I think that, I don't know that we've ever seen anything like this before to undermine the science like this. And so, it's going to take a long time to rebuild any trust or, to be able to demonstrate that there is actually deserving of trust. And it's really destroying a lot of our systems for how we do these things in, unbiased manners. I mean, on so many fronts, there are so many things that have been more non-political, that are supposed to be independent, that now are being politicized, and it's very scary.
So what advice do you have for the public right now, and for, not just pregnant women who are, listening to this and are worried about what they should be doing, but just patients in general, the public, in terms of how we should handle our healthcare during this time?
Well, I think I would listen more. I would listen to the physicians and the experts rather than some of these recommendations that are coming. RFK Jr. is not a physician. He has no real expertise in this. President Trump is not a physician or healthcare. I mean, as you pointed out, during COVID, there are these recommendations about injecting bleach and things like that. I think we need to stick with the professionals who dedicate their careers and lives to, to trying to solve these problems. And it's so, people say, oh, they're, I guess, under the influence of pharmaceutical industry and all this stuff. So many people, the people at CDC, and I've worked with them, for years. They're not making tons of money with what they're doing. They are dedicated, scientists and professionals that their only interest is what's best for the health of the kids or the population or the community. And that's what many people are dedicated to, and that's what we need to be putting those decisions and that process. Also, it's a process where you get the, really look at all the evidence and you put it out there very transparently so everyone can also see it. Some of these statements, they're not showing all the background or, what's the scientific justification.
Mm-hmm.
There are usually work groups. I've been on some of these work groups where, for months before, like an ACIP meeting, there are experts from various, areas that are looking at the scientific data, and discussing it
Mhm.
before even that ACIP meeting occurs, so that they've got all the evidence laid out and it's transparent. You can see why different decisions or recommendations are being made. And that's not happening now.
It's not, and it's for a lot of people, it's pretty frightening
Right.
that that's what's coming out. And and as you said, people need to listen to the experts who dedicate their lives and careers to medicine and to science.
Mhm.
I think we'll wrap there, and because you've given so much great advice and answered a lot of questions, important questions that I think people need to hear. So again, thank you, Dr. Huang, for joining me, and for you at home who are listening and are watching, please don't forget to hit subscribe.